Today we're going to look into the different types of prescriptions you will see in the UK. We'll go through each of these categories one by one. First, we have a general prescription. This is your standard, everyday prescription form, most commonly the FP10 form used by the NHS. Next is a military prescription. These are specific forms used for armed forces personnel. They have their own system and forms. Moving on, we have EEA and Swiss prescriptions. These are prescriptions written by doctors in the European Economic Area or Switzerland. Then we have a private prescription. These are issued by a private doctor and are not part of the NHS. The patient will pay for both the consultation and the full cost of the medicine. Repeatable prescription. This is for patients on long-term medication. Instead of getting a new prescription every time, a patient can get multiple supplies over a period of time. We also have controlled drug CD prescriptions. These are for medications that have a higher potential for misuse or abuse, like morphine. Hence, they have very specific legal requirements, including details like the dose, form, and total quantity in both words and figures. We will cover in more detail in Part 2 video. And finally, we have vet prescriptions. As the name suggests, these are for animal patients. The rules for these prescriptions are very different from those for human patients. We will talk in details in Part 3 video. Now, let's start with the most common, the general prescription. General prescription requirement applies only to prescription-only medicines, POMs. Controlled drug prescription has different requirement. We will cover those separately. This is the standard green form used for NHS prescriptions, known as FP10. A legally valid prescription must contain all the following information. First, the patient's full name and address. Patient's age and date of birth. Date of birth become a legal requirement only if they are under age of 12. A prescription must have a start date and need to be signed by a prescriber. The legal validity of prescription is 6 months from the appropriate date. This is either the date the prescription was signed or the date to be dispensed, specified by prescriber, whichever is later. It is important to remember that the validity for owing lasts until the expiry date too. Prescription for private POMs and Swiss or EEA POMs, the appropriate date will always be the date it was signed. The laws say that the prescriber's signature must be clearly signed in indelible ink or signed by advanced electronic signature generated by computer. It is legal requirement to include particulars of prescriber, such as type of practitioner, examples like doctor, or putting down their GMC number. We will also need the address of prescriber. Moving on, the clinical validity, the prescription should also include the medicine's name, strength, formulation, dose and direction, and the total quantity of prescribed medicine. While it is not a legal requirement, we need these bits for good practice and safe dispensing. All these requirements apply to other type of NHS prescriptions such as FP10D and FP10P and private prescriptions. In addition to the standard FP10, you might see other NHS prescription form. Same general prescription requirement applies to these prescriptions. We call this yellow form FP10D. The D here stands for dentist. These prescriptions are exclusively for use by dentists, and you can easily recognize them by their distinct yellow color. The key thing to remember about these forms is that they are restricted to medicines listed in the Dental Prescribers Formulary, DPF. This means a dentist can only prescribe a limited range of drugs that are relevant to dental conditions. This is a safety measure to ensure they're prescribing within their area of expertise. Next, we have the purple FP10P form. The P stands for nurse prescriber. These forms are used only by nurse prescriber. Just like with the dental forms, their prescribing is also restricted to medicines listed in the Nurse Prescribers Formulary, NPF. This ensures that nurses only prescribe from a specific list of medications relevant to their practice and training. Now, military prescription is a bit different. The form used for military prescription is called an FMED 296. This is a special form that is handled by community pharmacies who have a specific dispensing contract with the Ministry of Defense, or MOD. Without this contract, the prescription would be considered a private prescription, and the patient would be charged for the medication. As with all prescriptions, the same general requirements apply. These forms are mostly computer-generated, although handwritten ones are possible but highly unusual. You might also see an FMED with a British Forces Post Office BFPO address stamp. This stamp is generally for prescriptions that have been generated abroad for personnel serving overseas. This means you won't normally see these in the UK, but if you do, it's a good record to indicate where the prescription originated by checking the prescriber's registration details. Always check the registration details of the prescriber if you have any doubts. This is a crucial step for patient safety and for ensuring the prescription is valid. The prescriber's details on a military prescription can sometimes be different from a typical NHS or private prescriber, so it is good to be extra vigilant. Moving on to private prescriptions. Unlike NHS prescriptions, which have standardized forms, there is no standardized form for a private prescription. They can come in many different formats. In practice, they may look something like this. They can be written on any paper, but must meet the same general prescription requirements, which include all the legal particulars needed. One key difference is what happens after the prescription is dispensed. The dispensing of a prescription-only medicine, or POM, under a private prescription needs to be recorded in a POM register. This is a legal requirement. Prescriptions from the European Economic Area, EEA, and Switzerland are legally valid in the UK. You can find the list of EEA country in the MEP for your reference. These prescriptions can be in a different language, but pharmacists will need to have enough information for safe supply of medicines. Now, let's go over the legal requirements for these prescriptions to be valid in the UK. First, they must contain the patient's full name and date of birth. Second, they need the prescriber's full name, their professional qualifications, and their work address with the country clearly stated. This is vital for verification purposes. Third, they must include the prescriber's direct contact details, specifically an email address or a telephone or fax number, with the international prefix. This allows a pharmacist to contact the prescriber directly if there are any doubts about the prescription. Fourth, the prescription must detail the prescribed medication, including its name, strength, form, dose, and the total quantity to be supplied. Fifth, you need the prescriber's signature. And finally, the prescription must have the date of issue. It is important to note that Schedule 1, 2, and 3 controlled drugs and any medicines without marketing authorization in UK cannot go on EEA or Swiss prescription. This is to ensure the safety and legal compliance of dispensing these medications. Now, let's look at repeatable prescriptions. We can separate repeatable prescriptions into two main categories, those for the NHS and those for private. Same general prescription rules apply to all the repeat prescription. Let's start with the NHS side. On the left, we have the most common type, the normal repeat prescription. This is what you'll typically see for patients who have been prescribed a medication for a long-term condition. The GP will issue an FP10 form, and the pharmacy keeps a copy on file. The patient receives a repeat slip, that white form you see there. This slip is what the patient uses to reorder their medication. When they need their next supply, they simply tick the items they need on the slip and hand it back to the GP surgery. Now, moving to the second NHS option, we have the RA/RD repeat system. RA stands for Repeat Authorization, and RD stands for Repeat Dispensing. This system is for stable patients who are on the same medication for a long time. The GP will issue a single prescription for a period, let's say 6 or 12 months, and you'll get two types of forms, one for the RA and a number of forms for the RD. The pharmacy keeps the RA form on file, and the patient takes the RD forms. They can then collect their medication from the pharmacy at regular intervals, like every month, without needing to contact the doctor each time. Finally, let's look at the private repeat option. This is for patients who are not using the NHS for their care. The process is very similar to the NHS, but it's done on a private prescription form. The doctor will write out the prescription for a certain number of repeats, for example, 3 repeats. The pharmacy dispenses the first supply, keeps the original prescription on file, and then the patient can come back to the same pharmacy to get the next supply until all the repeats have been dispensed. Just like with NHS repeat dispensing, the patient doesn't need to go back to the doctor every time. In details, a normal NHS repeat prescription system used to allow a patient to get a repeated collection of the same medication. Note that, with this type of repeat prescription, the patient is required to contact their GP surgery each time they need a new supply. This can be done by visiting the surgery in person or by calling them. The GP will then issue a new prescription. This means that the GP must physically sign each new prescription every time the patient requests a repeat. This differs from a repeat dispensing RA/RD system, where multiple prescriptions are signed at once. We'll discuss this in details in the next slide. NHS RA/RD repeat system is an efficient system designed for patients with stable, long-term conditions. It allows a prescriber to issue a series of repeatable prescriptions all at once. First, let's look at the RA form. This is the repeat authorization form. It is the initial prescription that is signed by the doctor to grant the pharmacy the authorization or permission to dispense a series of repeat prescriptions, RD form, over a set period of time, which can be up to 1 year. This means the patient does not need to see the GP each time they need a new supply. Now for the RD form. These are the batch prescription, means a number of these forms are issued at the same time as the RA form to allow patients to get their meds from pharmacy. Each RD form is for a single dispensing. The patient can bring one of these forms to the pharmacy each time they need to collect their medication without having to request a new prescription from the GP surgery. There's no need of RD form to be signed, but RA form must be signed. Patient can keep the rest of RD form themselves or ask pharmacy to help keep it. It's important to note that majority of this system is now handled via the Electronic Prescription Service, or EPS, which is also called Electronic Repeat Dispensing, or ERD. You can see that it comes with a barcode and stated that it is a prescription token under the prescriber's signature column. Under this system, the prescriber can issue an electronic RA token to the patient. The patient does not need to physically collect RA token and all the paper RD forms, as the information is sent directly and securely to the patient's nominated pharmacy. This makes the process much more streamlined and convenient for both the patient and the pharmacy. Next is private repeat prescription. As with a standard private prescription, there is no set form, but there are some specific requirements that make a private prescription repeatable. The first key requirement is that the prescriber must explicitly state on the prescription that it is repeatable. If it is not stated, it cannot be repeated. The prescriber also needs to specify the number of repeats. For example, if the prescription states 3 repeats, this means the pharmacy can dispense the medication a total of 4 times, the original dispense plus 3 repeats. If the prescription simply says repeat, but no number of repeats stated, the pharmacy is legally only allowed to dispense 1 repeat, which means the patient gets the medication a total of 2 times. There is an important exception to this rule, and that is for oral contraception. Under the law, a private repeatable prescription for oral contraception can be repeated 5 times for a total of 6 dispenses, even if the prescriber doesn't specify a number of repeats. If it is not stated repeatable and no number of repeat, it is only allowed to dispense once. Just like with a regular private prescription, the dispensing of every supply, including all repeats, must be recorded in the POM register. This is a legal requirement for all POMS meds dispensed privately. Now we're going to go over the key requirements applied to all repeat prescriptions. With the legal requirements, no Schedule 1, 2, or 3 controlled drug are allowed to be repeatable, and the first dispensing of the prescription must happen within 6 months expiry. You should also know that for Schedule 4 CD drugs, there's a 28-day window for the first dispensing. There is no legal time limit for dispensing the remaining repeats after the first one has been supplied. Clinically, for every repeat, you need to check that it's appropriate for the patient. You should be asking for few things such as, Any change in their condition? Has anything about their health changed since the last time they were here? Any new side effects? Have they experienced any new or worsening side effects from the medication? Any new medications? Are they taking any new prescribed drugs or over-the-counter meds that could interact with their current prescription? Finally, we have the audit trail. Though it is not a legal requirement, it is good practice for pharmacy to stamp the prescription with the pharmacy name, address, and the date of supply each time a repeat is dispensed. For private prescriptions, you also need to make sure you're recording this information in the POM register. Thanks for watching! Study Smart with Pharmacademy by Luna.